Dario, and it's a pleasure for me to be here with you. I mean, I wanted to be here with you because, and to congratulate also PSI for organizing this workshop because we are living in a very exciting moment when it comes to occupational safety and health. As you said, in June this year, the International Labour Conference has adopted a resolution that added a fifth pillar of rights to the 1998 Declaration on Fundamental Principles and Rights at Work of the ILO. And this is, as it was already expressed here, it's a huge game changer. And I'll be very straightforward here. We are speaking here, at least for me, the most important of all human rights. This is the right to life, and this is the right to live healthy lives. And there is nothing more important, than this. Also, John went through, the diversity of risks, that also the diversity of occupations that we find in public service are exposed to. And again, this is also something that I wanted to stress. We are all workers, and we are all exposed, one way or the other, to occupational hazards. So, although we know that some sectors and occupations are more hazardous than others, we cannot forget that all of us as workers are exposed to occupational hazards. So let me just share with you or at least try to share with you my screen, where then I would lead you through, some ideas also, not only on what can be the role of the unions, in assisting, the ILO, government and employers to realize these new fundamental principles and right at work, but also to explain a bit more in detail what this right represents. So bear with me just 1 second, please, and I hope that you'll be able to see the screen already. Okay, great. So again, I also thought of starting with, the context we all know, and John has already addressed that very well. I mean, the public sector and local government, we have many different sorts of occupations working for public sector and local government. Each one of these occupations is exposed to very different hazards, both of physical and also mental nature. So I think I'll skip that. Because when I thought of the challenges that, I know from my experience working in the ILO, but also working previously in my own country, I'm from Portugal. And by the way, I'm a labor inspector, so I work very much with, the exposure of workers in many different sectors to hazards, including in the Portuguese public sector. So what I see is that it's most often the framework that countries have, starting with law and policy, that is a problem. Because in many countries, workers of the public sector, or at least some workers of the public sector, are not covered by the national OSH legislation. If they are covered, they may be covered by different laws and regulations, than those that apply to the private sector. Most commonly also legislation which tends to be a bit less protective, less detailed as well. Well, when the same law applies, what we see is that sometimes the mandate of enforcement authorities, namely labor inspectors, does not cover the public sector. And when it covers the public sector, there is no effective sanctioning. So there is no effective deterrent measures to bring national or local authorities to comply with OSH laws and regulations that apply to them when they apply to them. In many cases, and again, going back to my own experience, we know that sometimes public sector workers are not recognized as workers. We have problems of recognition of the employment relationship. We have many situations of false independent contracts, bogus self-employment, that of course we have to deal with, and we have to address this as a major part of the problem. As it was already mentioned, also quite often, in some countries at least, there are obstacles to the right to exercise, the right of freedom of association, collective bargaining that may not be concluded at local level. As you said also, Dario, many, especially in small municipalities, in some more isolated areas, it may happen that, as a matter of fact, unions are less representative than in other parts of the country. And also quite often, and here I would really be highlighting this particular challenge, public sector institutions are not covered by occupational health services, meaning that they do not have the expertise, either internal or external, to, as John just said a while ago, to conduct risk assessment, to select the most adequate preventive and protective measures. And this is a problem that, again, in many countries applies to the private sector, but very much and even more to the public sector, even in many industrialized countries in the region where we are operating. And I think that you all know that even better than myself. Again, so what was decided by the ILC this year in June? Again, not only that a safe and healthy working environment is now a fundamental principle and right at work, but also that the very large set of standards that the ILO has on OSH, there are two that are now considered fundamental conventions. And these conventions are, I would say, they are the blueprint of how we manage occupational safety and health at national level, but also to some extent at workplace level. And these are the conventions, number 155 and number 187. Why is it important to mention that these conventions are now fundamental? Because, as you may know, member states are only, the conventions of the ILO are only binding for the member states that ratify them, except the fundamental conventions, meaning now that all member states of the ILO, so all of our 187 member states, have the obligation to respect, to promote, and advance the rights which are, contained in these two conventions. And this is of fundamental importance. Why? Because these two conventions bring us, they introduce us, the main tools for the management of occupational safety and health, which, by the way, is something that is universal. So according to Convention 155 and Convention 187, all of these provisions apply both to the private and to the public sector and to all categories of workers. There is no exclusion. Again, member states may, in consultation with employers and workers' organizations, especially when they ratify the conventions, exclude a given category of workers. But what is expected is that progressively, the scope, so the application of these conventions is universal. So the conventions as such, they have a universal scope. So what is very important here is that the two conventions introduce then, these three main instruments for the governance of OSH at national level. First, the national OSH policy. So Convention number 155 says that every member state of the ILO now has to formulate, periodically review, and implement in consultation with the most representative organizations of employees and workers, a national policy on occupational safety and health. The scope of the national policy is defined by the convention. So, and the objective of this national policy is, of course, to prevent any negative outcome out of exposure of any worker in any sector to occupational hazards. The policy and the way that Convention 155 defines the policy is quite important because it goes well beyond the mandate. Well, what are the main, let's say, stakeholders for the ILO, which are, again, the ministers of labor, the ministers in charge of labor, because they require to look into all that relates to the manufacturing, importing, work equipment, machinery, substances, etc., because they do contain a provision which relates very much to what we call, the principle of safety by design, meaning that, when a given workplace selects a machine, an equipment, a new substance, or even when the workplace defines, a work method, it's at that moment that the principles of prevention should be addressed, meaning that our risk assessment starts well before work starts at the workplace, and this is contained in Convention number 155. Then again, also something very important of Convention 155 is that again, all the elements of the policy are to be discussed with social partners. And also Convention 155 on the provisions that apply directly to the workplace it is quite clear that it is the employer, it doesn't matter if it's a private or public employer, that has the duty, the obligation to ensure that all workplaces are safe and healthy for all workers. Also, Convention number 155 says that the management of occupational safety and health at workplace level is to be done in constant collaboration and with the participation of workers and workers' representatives. Again, private or public sector. You'll also find some, two other very important provisions on Convention 155, then again, should translate to the formulation of national policies, which is the fact that, first of all, workers have the right to refuse work in situations of imminent and serious danger. They should report to their immediate supervisor that they have identified a situation that would entitle them to use this right to refusal, and this right to refusal applies again to all workplaces, all sectors, and all categories of workers. And furthermore, Convention 155 says that the employer cannot retaliate the worker for making use of this right. The other important provision of Convention 155 that should translate to national policy and law, again applicable also to the public sector, is that when there is a subcontracting process in a company, or when we have more than one company, more than one employer operating in the same workspace, and this is quite often the case for many public services. Think of a public hospital, think of any social service where you have companies dealing with which these services are most often outsourced: security, cleaning, maintenance, etc., etc. So it's the obligation of all the employers to cooperate, but also it's the obligation of the employer that has the domain, the control of the workplace, to exercise his own duty of diligence. Then again, the Convention 155 also makes it quite clear that it's very good to have a national policy, to have a national law, but you need to have an effective enforcement mechanism. And this enforcement mechanism, usually the National Labor Inspectorate, or OSH Inspectorate as called in some countries, is to apply again to all sectors of the economy, including the public sector. And here, as I said before, there is sometimes a kind of a gap. The convention also refers to the duty of the employer to inform workers representatives, and also to train workers on not only on how to recognize the hazards which they are exposed, but also to correctly use all preventive and protective measures. Let me just move to Convention 187 because I know that the time is quite limited. So Convention 187 basically it says the following: okay, we have a national policy as an obligation deterring out of Convention 155, but we also need to have a national program. So it's a national program or a national strategy with precise objectives, indicators, allocated resources, so that we can implement the national policy. And again, this national program is a program that should be universal, covering all occupational hazards, all sectors, and all groups of workers, including, of course, all workers in the public sector. In addition to the program, this is the correct slide. Apologies for that. In addition to the program, what Convention 187 says is that all of this should work within a national infrastructure for occupational safety and health. So a national system for occupational safety and health composed of several elements. And you will find, as the elements of the system, of course, reference to the national legal framework. Again, the enforcement mechanisms, but tripartite bodies for social dialogue when it comes to occupational safety and health, all that relates to the availability of occupational health services, OSH data through reliable reporting and recording in notification systems, and also adequate social security schemes that may look into the adequate compensation of those workers for which we were not able to effectively prevent their exposure to different sorts of occupational hazards. So this, what does all of this imply for the public sector, for local workers, in working in local services? Well, first of all, and I mentioned this, but I'm going to repeat this once again. This convention, so this new fundamental principle in right at work, applies to the public sector. There is no doubt. The other also conclusion to extract from this is that, well, the element of social dialogue is cross-cutting, throughout, these two fundamental conventions, and as such, social partners are very important pressure points for governments to either those that have not yet ratified these two conventions to move towards ratification, but also those that still do not meet the conditions to ratify the conventions to respect, promote, and realize the rights that are contained on this convention. So again, we as the ILO, of course, that count very much on the support of unions so that we can make progress again towards making this very important fundamental right a reality for all workers. So back to you, and of course I'll remain here for any questions that colleagues may have. Thank you.